Dr. Bhaskar is an award-winning clinician scientist and academic neurologist with a specialization in vascular neurology and, neuroradiology, with research interests in global neurology, health systems, and public health. Dr. Bhaskar is the founding director of New South Wales Brain Clot Bank, a flagship world-first initiative established with the funding from the New South Wales Ministry of Health. Dr. Bhaskar leads national and international initiatives on reducing health disparities with a focus on vulnerable populations and under-resourced settings. During the COVID-19 pandemic, Dr. Bhaskar is leading the Pandemic Health System Resilience Program, Reprogram, international consortium formed to champion the safety of healthcare workers, policy development, and advocacy for global pandemic preparedness and action. We are delighted that Dr. Bhaskar is also a prominent member with us, with UNAA and SW, and we're delighted to welcome him. Thank you very much, Doctor.
Oh, thank you, Joshua. And first of all, just want to acknowledge United Nations Australia and New South Wales for the privilege to join such an esteemed panel today. And I'm really looking forward to a more interactive session. I'm just going to, change tracks and make it more interactive. And the question, I think, previous speaker has touched upon a very important part of vaccine hesitancy and mental health and obesity. I'm looking at, I'd like really the audience to zoom out and think about the health systems perspective. And that's what has been really the focus of my work over the last couple of years. So I'm going to talk about building resilient health systems today. So I'm just going to, so what can you expect out of this presentation? I really want to take you through what is the pressing need for the health system's resilience. What are the frameworks that we can look forward to? What's there existing, and what are the experiences during COVID-19 that can teach us, but also experiences that we can take forward? And with that, I'll provide some recommendations for all of you to consider. Now, beginning of January and March 2020, you all have been touched one way or the other with the COVID-19. And I just want to not just talk about numbers, but think about those individuals who have been taking the toll of COVID-19, which stands now at 2.8 million global deaths around the world and about 132 million cases. And think about their families who have been affected. So there's absolute case for having an increased awareness about pandemic around the world, but also more about how do we build health systems capacity for future in advent of a future pandemic. This is a very sobering picture from Italy, where, as you can see that there are coffins of deceased people lying in the church without much attendance, and the priest is sanctifying the place and offering the prayers. So just tells you bringing that system, but also zooming in and thinking about individuals who have gone because of the COVID-19. Now, from an Australian perspective, I think we have been very lucky and fortunate to have a very systematic approach to pandemic prevention and detection. And you could see that the total number of cases in Australia has been conservative, about 28,000 cases, about 900 deaths. And as if now we don't really have a case of COVID-19 across intensive care units across Australia. So that's a very positive story. Well, the United Nations defines resilience as the ability of a system, community, or a society exposed to hazards to resist, absorb, accommodate to, and recover from the effects of a hazard in a timely and efficient manner, including through the preservation and restoration of its essential basic structures and functions. Now, if I take you through the individual components of what I just spoke about, so it talks about prevention, you talk about avoidance, withstanding those shocks, such as the pandemic or a natural disaster, as we have seen before in Australia, absorbing those shocks, as for lack of words, but also to recover and adapt to those natural shocks. Now, what has COVID-19 did to our community? It was uncertain, it was random and unpredictable. Most of the natural disasters are. And with that, I'll take you through this particular diagram. And So you got the COVID-19 disruption, and then it really affected the health system's capacity to really tackle the patient workload in the outpatient clinic, so on and so forth, but also the looking after patient continuity of those patients who required continued access and care. Now, that particular diagram then slowly and gradually started recovering over time, as you can see in Australia, but then it slowly, goes up, and then you see the green patch, which is about adaptation to the pandemic and external shock. So if I were to define the resilience, this is how I would put it together. It's the ability to respond to acute needs of a crisis, the capacity to learn, adapt, and innovate, and most importantly, how do we future-proof our systems? Now, on that note, if we were to put a health system resilience framework together, this is how it should look like. We got the health systems resilience capacity, which really consists of three different components, which is abundance in the scientific literature, where you got the cognitive component, the behavioral component, the standards and SOPs and protocols, the contextual, which is, for example, the pandemic or a natural disaster, so on and so forth. And with that, you got to have the strategy to build a health system resilience, which really encompasses three important paradigms. One is the absorptive, which is how to actually address the acute needs of the shock. Then you go on to the next phase, which is the adaptive phase, where systems start maturing together, and then you think about continuity, maintaining the continuity of the normal health system workload. And then probably through that, you into the transformative phase, where you come up with ideas which can help build future restorative capacity. What do we want to achieve with this framework? It's really about health system strengthening, building systems which are strengthened over time. And in order to do that, you actually maintain continuity to deliver the essential health services, which is not just in Australia, but around the world, especially in developing countries, has taken a big toll. And most importantly, to reduce the disparities and inequities in healthcare here in Australia and, of course, globally. And what are the key lessons that we have learned from COVID-19? I think Australia is a testing case where we know that driven by science, research and development, policy expertise, we can really put this thing under control. And we had quite a success in Australia and New Zealand. Social capital, having that people, vaccine hesitancy and all under control, having that trust between communities that they will adhere to those policies is so important. Good governance. When you talk about the transformative, strategies, you really need good governance to ensure that the policies and procedures are being monitored regularly. The early detection and tracing mechanisms that we have seen successfully being implemented in Australia. And of course, the provision and access to rapid testing, the new technologies that's coming up, artificial intelligence, point of care diagnostic tests and rehabilitation programs, all of that to be incorporated as we develop the response acutely. And most of all, you actually would notice that during the pandemics, it's a vulnerable community which are most disproportionately affected. So it's really to protect those communities should be the prima facie, the important thing. And as you probably know, that in UK, United Kingdom, we had the National Commission to investigate the disparity of death among the BAME communities in UK. And of course, with that comes the addressing the social determinants of health, the systemic barriers in health, which continue to plague our system. And I think Valsa has touched upon some of those issues. And last but not the least, how do we maintain the continuity of care while maintaining the capacity of health systems? Well, at the beginning of the pandemic, we, a group of about 150 physicians and health policymakers around about 25 countries around the world, we came together and really to dedicate on a global platform on health equity, health system resilience. And what we have done is we come up with really defined and evidence-based policy development, advocacy for global pandemic preparedness and action. And that's what we call Reprogram Consortium. So much of our work is now in the public domain, but one of, really put together global effort to drive a policy and evidence-based treatment towards building capacity in low resource settings through collaboration in telemedicine technologies. So this is an example of one of the earlier acute stroke protocol that we developed in collaboration with partners in US, in India, in UK, and in several parts of Europe. And as you probably know, the initial phase of the pandemic, we saw the decrease in acute stroke presentations across some of the centers around the world. That was a concern of, for vascular neurologists, and then led to a campaign about increasing awareness that even if the pandemic is there, the chronic care, the acute care needs should not be undermined. With that, we also looked at the telemedicine penetration, but as you know, the primary driver of our capacity to withstand COVID has been the transformation or transition to telemedicine. Now, what are the gaps across the world, not just in Australia, but across in Europe, in the Middle East, in the developing countries of the world? And how do we address those gaps based on health policy determinants? And we looked at different drivers of I'm not going to touch base on really on that aspect, because today I'm going to talk about an important issue, which was a major problem in Australia at the beginning of the pandemic. At the beginning of the pandemic, you would have noticed that we had acute shortages in the medical supplies, the PPE equipments, and that was a matter of concern for many of the healthcare workers. And it was true about the United States, so on and so forth. So we put together a consortium with colleagues from Copenhagen, from UC Berkeley, Singapore, Eindhoven University, Netherlands, and that consortium looked at detailed mapping out the current status of the acute global supply chain debacle and really revisiting some of the issues that can be addressed. And what we came up with, that there was an acute need for revisiting governance and resilience of the supply chain platforms. That was really amplified during the pandemic. And what was some of the significant findings? That the tragic failure of the global supply chain has caused acute shortages in personal protective equipment, but also led to crushing fear among frontline health workers, fundamental concerns about sustainability of the health system. And it was actually through consensus, it was realized that more coordination, integration, and management of global supply chain is required. So we came up with a very robust global supply chain model, which is really about bringing together strong governance and use of advanced analytics and blockchain technologies. So this particular technology platform, as you can see in this particular diagram on the right, so you got the big data analytics and the artificial intelligence platform sitting within national supply chain centers, which profiles and acutely monitors the current supplies and then anticipates and forecasts what is required. Then, because it's a blockchain technology, it doesn't really reveal the suppliers or the procurers. So you maintain the privacy and the trust between the suppliers and the procurers. And through that, we also proposed that there should be regional stockpiling. So for example, in Ireland, there was an acute shortages, but there was a need for regional mechanisms by which the regional stockpile could be developed. South Asian countries have been quite robust in their regional stockpile consortiums, and I think that could be replicated across in other parts of the world. So through this particular policy-based piece, we have proposed a new governance system that supports intervention by public health authorities during critical emergencies and regional stockpiling, which is really central to our recommendation. Now, what are our recommendations for future? So we really truly believe that the action plan centered around global health, which is really to integrate public health response during the COVID-19 is required. We got to integrate technologies and telemedicine platforms in our response, and also to make ourselves prepared for such an outbreak in future. There's a growing need for understanding about international standards of interoperability, which systems like blockchain can deliver for us, which will also open up standards for data sharing across the wide telemedicine base. Open platforms for connectivity is important. Many of the developing countries, underdeveloped countries in our consortium, they were reporting about lack of platforms. They didn't have the proprietary platforms they could use. So really developing that open platforms which these physicians in these communities and of course the health systems could use. Digital literacy and language barriers were key impediments. Even if you have technology, whether those technologies are linguistically appropriate to the communities, whether the communities and individuals know how to use those technologies is so important. I think that some of the efforts in Europe and in South Asia has been quite remarkable and developed around appropriate legislation, governance framework will be critical. And we really need to have the focus on healthcare workers because they are the front line. So there was an increasing list of people in the healthcare workforce who were falling victim to COVID-19 and continues to. So protecting our healthcare workforce and the vulnerable communities should be the prima facie, the key determinant of how do we develop a plan for future. And building primary healthcare facilities and community health capacity is important. And engaging with key stakeholders, not just health systems and the healthcare physicians and the leaders in the healthcare, but also dealing with the community leaders and understanding, addressing issues of vaccine hesitancy is so important. Now, in terms of telemedicine capacity, we really need to shift our focus to our vulnerable communities because at least in developed world, the systems are at to a certain level available, but these are really unavailable or the lack of access is acute in some of the underdeveloped countries. Now, to summarize, I think partnership, leadership, and inclusion. Inclusion about the vulnerable community members, reminding ourselves that they, how you keep your society and those at the margins of a society will define the skeleton of your health system's resilience. Developing partnership between non-government organizations. I'm very active with Rotary International, and Rotary does so much of work around in the community, and really bringing those stakeholders together with the health systems will be critical in our response to pandemic. And leadership, we really need leadership, not just political, but health systems leadership to improve health outcome for patient and communities. And putting empathy and compassion right at the front, right and center of that debate is important. But I mean, no work is, we don't reach there on the top without the support of everyone. So very grateful to my wonderful team here in Australia, but of course, around the world. It's been a very exhaustive exercise, but in times like this, as you can see on the right, you've got the koalas really, huddling together at a time when the entire population of koalas in the rural New South Wales were wiped out. So understanding that compassion and building resilience is so important, not just for health systems, but also in our communities in how we address the pandemic such as COVID-19 today and in future. But thank you very much for listening to me and really look forward to further questions and engaging with the panel. Thank you.
Thank you very much, Dr. Bhaskar. That was very informative and in a way that I suppose we were hoping. You have done something that we expected as a event organizer and tied the previous three speakers together so nicely. At the end of the day, it is about partnership, leadership, and inclusion, and all, with the essential ingredient of compassion and empathy, that an important element that cannot be dismissed at any level of health concern addressing. So we really appreciate you. I appreciated that element being touched on at the end there. In relation to vulnerable communities, that aligns so perfectly with the UN's overall mandate of leaving no one behind as an essential core piece of addressing, and the achievement of SDG 3, good health and well-being, as well as a mandate of the World Health Organization. So there is a strong alignment there, which is fantastic. We did have a question come through. Let me pull it up. What health systems across the globe have been the most resilient during COVID and why? So we're speaking, I expect that means China, New Zealand, Vietnam, Taiwan, etc. What led them to be more resilient than other countries, do you think?
Great question, Joshua. I think one of the key issues that has come up in terms of resilience of these health was their previous experience. I mean, of course, Australia could be an exception. I mean, not taking away the experience during H5N1, but across in the Southeast Asia, the Singapore, for example. So they had previous experience with pandemics, and they really put together a national cohort of policymakers, the physicians, the community leaders, and they had systems in place, which I think was a critical driver of their response to pandemic. You compare that with the United States. In the Trump administration, don't want to be political, but in the Trump administration, before the pandemic hit, they had actually completely defunded an entire department which was looking after pandemic response. And if I were to give you the figures, so in terms of the national stockpile of the medical supplies in America is substantially provided in times of pandemic. So when the pandemic hit, they've already in short supply. And not just to talk about America, look at Australia. The national stockpile, the governing body of the stockpile in Australia in Jan 2020 had about 12 million of the million masks available in the country. Now, if you compare that with H5N1 10 years ago, we had about 140 million masks available. So what does it mean? That we actually used up our resources and we didn't build up our resilience over time in that. And then when the pandemic hit, we were really acutely short supplied with the provision of the PPE equipment, so on and so forth. So understanding that not just the developing nations, but Australia even, I think we have got lessons to learn from this, that the national stockpile need to be not just be developed with keeping into mind a pandemic which has now developed, but also in a future pandemic that may arise in future. And probably this will be the lesson that we can take in Australia. But of course, our policy response has been phenomenal because it's been guided by experts in the domain. And that has been the success of Australia and New Zealand. And unfortunately, the stark differences you can see in North America, despite the great infrastructure, health infrastructure you got in America, but they have been really caught in a very difficult situation.
Indeed. Absolutely. Thank you for the answer to